Okay, it is exactly 8:30 p.m. Central Standard Time, and today is Wednesday, August the 25th, 2021, and welcome to week number three, three of Drugs and Crime, and I'm Richard Wright, your instructor, and I do want to again remind each and every one of you guys, and I think you're doing pretty good with it, is make sure that you follow the rubric. Make sure that you follow the rubric. If you want to see how you did with your assignment in week one, look in your grade book and then look at the rubric, and then there is a feedback section under the bottom of each section of the rubric. And I'll generally make comments in the first section and then the last section, but sometimes I will make comments throughout and you will know what you did wrong. So it's very important to follow the instructions. Common errors is not complying with APA, and then not satisfying the length requirements of the written assignment. If it says 2 pages, it means 2 pages. It should be double space, not single space. Citations in the body, references at the end, cover page, and a reference page. And no, the reference and cover page do not count as pages for purposes of a 2-page written assignment. So it is very important that you do so, that you do conduct research, that you make sure that you have some critical thinking in there so that you don't just copy and paste everything and get a high Grammarly percentage. Most of you guys, this hasn't happened with, but I'm still saying it nevertheless, because we're entering the stage now where week 3 is the halfway point and we have less than a month before this course actually ends. So let's start by sharing my screen. And you will see, let's look at the student preview for purposes of emails. So you start out with messages, and you'll see messages I've sent you. And I've sent you a copy of Illinois Senate Bill 3023, which we're going to be using in the next few weeks. And then I also sent you the PowerPoints for this week as well. And then I will be sending you the link to the recording tonight as well. Okay, so be sure that you do follow that. So now looking into the grade book, you can see the assignments. That's all you'll see because of the fact that I'm using the student view. So it tells us we have a discussion post, enforcement or treatment, and we have an assignment, connection between drugs. Okay, connection between drugs, and you'll see that in just a few minutes as I open it up even more. The quiz, of course, is due. I don't show you, but you already know how that works, which involves everything for the week. And then your live classroom key phrase or word is due. So notice the 3 things: the assignment, quiz, and classroom are all due Sunday, the 29th. Your initial post for this enforcement or treatment was due yesterday at August the 24th at 11:59 p.m. Central Standard Time. And then your reply post is due this Saturday, the 28th. All right. So let's take a look at the discussion post real quick. And you see, you're going to determine whether enforcement, war on drugs, or treatment and rehabilitation is the best approach for reducing drug-related crime. I'll talk about that tonight. You can read the following, that link: optimal dynamic allocation of treatment and enforcement in illicit drug control. That's a source that you read in order to complete the discussion post for this week. So select either enforcement, treatment, or rehabilitation. If you selected enforcement, explain why we need to continue enforcement war on drugs. If you selected treatment, explain why we need to focus on treatment and rehabilitation. Defend your selection as the best approach for controlling drug-related crime. Describe the pros and cons of your selection. That's due yesterday. Reply post: do you agree or disagree with your peers' post and why? Add an additional pro or con for their approach, or provide a website link to a current event showing the success or failure in that instance. So it's important for you to make sure that you complete that by Saturday. Very, very, very important. Okay. All right. Let's go to the next assignment, which is the connection. So let's open up the assessment. Connection between drugs, mental health, and crime. And we'll talk about that tonight. Remember, once again, you're using Dave's scenario and his circumstances to relate to law, mental health, and corrections for each of these weeks. So for this assignment, for week 3, you'll need to address the following. Describe the connection, if any, between mental health and the self-medication phenomenon. Identify how this connection impacted Dave. Summarize the risk factors for criminal behavior due to substance abuse and mental illness, and identify Dave's risk factors. Explain the relationship between substance abuse and criminal behavior. Identify the relationship in Dave's scenario. It says at least one credible source. Remember, my role, my position is the more credible sources you provide, the better your paper will be. You can have minimal credible sources, and that'll get you beyond emerging. However, though, if you want to get to mastery, which, as I say, is your goal, which we're going to show you in a minute with that rubric, you're going to want to cite more than one source. All right. Citation in the body, properly done, APA formatted, and then your reference page as well. And then it must be in the form of a Word document. It cannot be any other form at all. All right. So we're going to get out of this. Close this for because I'm not going to show you the quiz, because you'll know about that. You know how that, and the live classroom lecture. So what I'm going to do is I'm going to get out of this, and I'm going to go back to exit this preview. So now I'm going to go back to the normal. So now let me show you the entire rubric. Now, I repeat again, and I say this over and over and over. There's your same information there. But the rubric starts from left to right as soon as it comes up, and there it goes. Mastery, proficiency, competence, and emerging. Notice that you're going to have to cover each of these sections that I already addressed: mental health and self-medication. Thorough of how this connection impacted Dave. Thorough. Notice what happens is you got to provide resources to support that. All right. Here, if you provide one, you'll probably end up here. I mean, if you provide two, you'll possibly end up here. Three or more, you'll probably end up over here. Competence is one, and then missing, you will not describe mental health and self-medication and not have anything to support it, and you'll end up in emerging. Notice that's almost half the points lost. Risk factors. So exemplary summary of the risk due to substantial abuse and mental illness. Same thing as I said up here applies here. Okay. Your goal is to operate with mastery. Make sure that you have credible sources. Exemplary. If I was completing my assignment, I would always shoot for exemplary. That's an A-B paper. Here we start to get to C, D, and then F. All right. Notice again, you got to thoroughly do it and ask yourself, did you do that? And students will ask me every time. I will generally tell you there's a feedback section in your grade book. In the grade book. And it will show you under each section, after the bottom here, is a section for feedback. And I will, depending on what I picked, if I pick one of these, this one right here, I won't give you any feedback because that means you complied. But here, if you, from here on down, I will give you some feedback and tell you what you didn't do. All right. But actually, to be honest with you, your rubric is self-explanatory about how to get 100 points. So credible sources with no errors. Attempted, like I said again, you might get here if you got three or more, if you got two here, if you got one here, and if you got none, you're going to end up automatically over here. And that's going to adversely affect your, see, you can't give me complete explanation without giving credible sources in each one of these sections. It's very important. And then a 2 to 3 page paper, double space, not single, double space, with correction, no spelling errors and things like that. If you don't meet, if your paper is less than 3 pages, I'm going to, in this section for professional language, you're going to end up with starting out with that percentage of it. So that's it for the assignment. Again, it is due Sunday, 11:59 p.m. Central Standard Time. All right. Right. So now let's go to, so we did discussion, we did the assignment. You know about the quiz, it's timed, and then the live classroom recording right here. You'll find the link here that will be changed over to the recording link, which will be after we complete this. And then your live classroom lecture. So, okay, before we start to talk about this, and this, I want to go to the calendar to remind you again of where we are. Here is your calendar. This is where we are. Last night, the initial post was due. Of course, the live lecture, and if you click on it, takes you to the page. And at the bottom, it has the hyperlink again to get to the lecture, which I won't click on because it will cause a double entry for me to be into the lecture. And then your reply post is due the 28th. Your written assignment that I just went over is due Sunday. Your live lecture, and then your quiz, which is timed again. And as you know already, it's closed book. So now you will notice that starting next week, we will be doing we were heading into the final month, which is September. Notice the course actually ends on the 17th at 11:59 p.m. Central Standard Time. So it's very important for you to get your assignments and information in by that time. All right. We're not ending the 18th, the 19th, or the 20th. And remember, good people, that if you have a problem, you will want to reach out to me. Remember what I said. Let's go back to it again. By texting, emailing, or calling me. And students say, I don't know the number. I gave it to you in the first week in the syllabus, but here again is how you can find it. Click on information here, click on the syllabus, and instantly it will show you my name, the thing that I just said a few minutes ago about your parameters for communicating with me, and then the phone number. All right, which leads to this phone here. If I have an urgent issue, the last thing I'll do is email the professor. All right. All right. So reminder that we focus on APA in this course. Student said to me, I didn't know that. Well, it's right here in this paragraph right here. Documentation style. University has chosen APA as the standard documentation and citation style to be used in all courses. And we have plenty of sources in this course to help you out with that. All right. So let's get to talking about the topic here. All right. Get the assignment, discussion, quiz, live recording. Hey. So, as you should know, there is a correlation between crime and drugs. I say this over and over and over again, that it's almost second nature with you in this class. People commit crimes to support their drug habits. Drug use and mental health. Drug use is on a rise for many reasons. Some start out as innocent, and some start out as somebody just trying to be social, and they find themselves graduating to opioids and heroin. But if you have mental health problems and you use cocaine, it increases the chances of you committing a crime. It says mental illness does increase the use of addictive goods, like I said a few minutes ago. It says by roughly 20% for alcohol, 27% for cocaine, and 86% for cigarettes. What people do is they use those to try to hide or run away from their problems. However, what you should be aware of is if you do engage in one of those activities, even after it's over, you might have a worse problem, such as cigarettes. You might have lung cancer. Cocaine, you will be an addict or addicted. And then alcohol, you could have cirrhosis of the liver and other illness that come about as a result. So in America, it says all recorded mental health patients, 38% use alcohol. Pay attention to the next statement. 44, which is the highest, use cocaine. and that could include heroin and other opioids. And then 40% smoke cigarettes. So opioids, methamphetamine, marijuana, and other drugs are often used by those with mental health issues to cope with their existence. And so it creates additional problems, though, for individuals. And if you look at this little chart here, you can see how the mental disorder, that is, you have a mental issue already, and then you add substance abuse into it, it can worsen the course of both the mental illness and increase the likelihood of substance abuse. Moving right along here. Life and stress experienced by people create mental illness and situations where people can't cope. I encourage you to take a look at my video that is in the announcements for Adversity is the Springboard to Success. Yours truly fit the prototype for my life experience, especially from what I saw in my childhood and lived all the way up to my adulthood, of a person who could be in a highly stressful situation resulting in mental illness and create problems where people like myself who went through things like that would turn to drugs. And it has happened because, as I've shared before with other students and will share with you guys, that my baby sister, I think I shared it week 1, my baby sister overdosed with cocaine. She couldn't cope, and crack cocaine, in fact. So that was a very difficult thing for me in 1994 to have to deal with. But all of these things combined, your pressures and the approach that you take and utilize to survive, can create a temporary relief. But as it says here, particularly if it's cocaine or methamphetamines, you will crash later after the effects wear off. So it's like temporary. Now, self-medication, it says, does little to eliminate mental health issues. To the contrary, coming down from drug-induced feeling can deepen the mental problem and create an up and down cycle. So you can be depressed, delusional, paranoid, and other types of things can lead you to other drugs, make poor decisions and things of that nature, and result in, once again, dare I say, criminal activity. We talk about addiction risk factors. They increase with stress in your life and the circumstances. It says looking at criminal behavior is no longer as simple as see the crime, arrest, prosecute, and incarcerate the offender. I say that all the time. Of course, due process, it says, needs to consider the mental state or criminal intent of the individual and take steps to manage the causes of criminal behavior to reduce crime effectively. And that's the key thing, to get to the heart of the matter. I've already talked about taking people from 12 o'clock to 6 o'clock in this class, where you go in a new direction in terms of starting your life. But there are risk factors that are basically biologically induced, psychologically induced, and environmentally induced. Biological factors include, it says, usual early response to the substance or experience, attention deficit disorder, ADD, or other learning disabilities, bipolarism, and then addiction among biological family members, and it's passed on. Psychological, where a person has low self-esteem about themselves, PTSD, post-traumatic stress disorders, or victim of abuse or other traumas. This happens quite frequently with individuals who have served in the military and have gone off to areas like Afghanistan, Iraq, Iran, Vietnam, the Gulf, and all of those different types of places. And it psychologically affects how those individuals may relate to other people. And then this one is one that I'm familiar with. Um, Ready access to the substance or experience, abusive or neglectful home environment. That's the one that hits me. Um, Misperception of peer norms, membership in oppressed or marginalized groups. That is, groups that get high, you hang with them. Life events. I know all about that, including chronic or acute stressors. Things in life that do that. At the present time, I can tell you, to be honest with you, that as I speak to you now and I'm teaching, uh, we have some things that my wife and I are dealing with involving um, our family that create that situation. However, though, we choose not to go with alcohol, drugs, or things of that nature. Our way of coping with it, to be honest with you, is our beliefs in God and how we operate and stand firmly with that. Okay. So let's talk about what's happening. There are more and more and more young people who are involved with drugs, began at an early age. I mean, even as young as 10 to 12 years old, and can affect how they grow up. So let's look at the risk factors. Um, and I've already talked about some of those. Chaotic home environment, um, ineffective parenting because the parents have problems that were never dealt with, um, little mutual attachment and nurturing, inappropriate or aggressive classroom behavior. I taught special education a few years back, the beginning around 2001, 2, 3, and 4. And I had to deal with students who were behavioral disorder kids. Academic failure, low academic aspirations, poor social coping, and goes on down to the last two, which are really big. Perceived external approval of drugs, where there's people that they hang around with. Parental substance abuse or mental illness, as I said, is passed on. So what protects individuals is the antithesis of those things: strong family bonds, parents in their lives. You can still succeed without your parent or parents, as I have, as you know my story. Clear parental expectations being established, and academic success. Um, Strong bonds with social institutions such as school, church, community, and I told you about that, being a pastor, and conventional norms about drugs and alcohol. We're going to talk a little bit more about that in just a few. So substance abuse is something we deal with quite frequently with juveniles. Talks about ADHD, attention deficit disorders, and how it's really something that's even more stimulated by the use of drugs and exposure to alcohol and so forth. So just be aware of this as you continue to look at this more in detail, that mental health has a strong correlation involvement with individuals who commit crime. All right. And the risk factors are very much prevalent based on the situations that I talked about, how people live their lives, who they associate themselves with, and so forth. So let's look at law enforcement. So, okay, we had the prohibition, and when it ended, I mean, it actually allowed the 21st Amendment to allow alcohol to be sold legally. All right. And you could look at the history of drug culture and policies starting from 1914, um, when when cocaine was declared to be illegal. Marijuana was made illegal. 37. In the 60s, there was a lot of um, marijuana and cocaine with other cultures that were involved. Um, Along the marijuana, introduced LSD. And these were chemicals where people went on what we call trips and zoned out, mind altering drugs. In the 70s, marijuana was made illegal again. In 70, it became a Schedule 1 along with heroin. So you know, though, as we speak now, that marijuana, which I will allege till my days end that it is a gateway drug, is now be legalized in many states across the United States and is sold legally through dispensaries where the government controls in the jurisdictions where they're located, the states and the counties and the municipalities, and that there is now legislation pending on the federal level to make it legal on that level. So what we're doing is using this same activity to help with revenue. However, once again, to me, it's creating a problem for individuals in terms of being able to survive. So in the 80s, the war on drugs began by criminalizing drugs and substance abuse and imposing mandatory sentencing. Two things happened with that. Number one, there's legislation passed to try to adversely impact drug use, abuse, and addiction. And the war on drugs started on the federal level, and the states were passing laws giving mandatory sentence for being caught in possession with drugs. However, one of the big problems that came about, and it talks about here, crack cocaine was cheap enough to be a street drug, and it gave the users a mental high that helped them manage their feelings or mental illness, mental health for a while. And I was the village attorney and a police officer in a town in the south suburbs of Chicago called Ford Heights, which was also known as the crack cocaine capital of the south suburbs, where crack cocaine was cooked in the houses, vacant houses, all kinds of places, and was sold, and it was very cheap, but there were all kinds of problems. And then there were people who would overdose or get addicted to it as well. And so if you were caught with this, the law began to operate under the war on drugs with sentences being given to individuals and not considering the circumstances of the individual. For example, it says possession of a small amount of crack cocaine for personal use carried a mandatory, did you hear me, prison sentence that would preclude what might have been parole or early release. Small quantities of marijuana were felony crimes and destroyed the future of many individuals. You couldn't get government student loans, and you couldn't operate in your careers in the future. And what happened is that it started to cost us tremendously. Jails and prisons were overcrowded. It didn't resolve the problem just locking people up, because these people were sick people who needed health. And then oftentimes, as it's demonstrated earlier, that mental illness was associated with it. And individuals that I represented as a lawyer, we went to drug court. And often in drug court, we ended up accepting pleas and seeking to get help for those individuals, because it is quite clear that what takes place is that when individuals are locked up and then you release them without addressing the drug issue, they're going to be right back at it. In fact, they might be worse. Why do I say that? Because it is well established that drugs are readily available to individuals when they are incarcerated. So the overcrowdedness, not treating them or providing adequate services, and more people were going to prison, and it created a really disastrous situation, not just for those who were behind bars, but for once they were released back into society for the community. All right. So since the 1990s and 2000s, the war on drugs began to lose popularity. Um, Lawmakers, criminal justice professionals, public and mental health professionals were advocating treatment and a rehabilitation strategy, and avoid, where possible, a prison sentence. Now, I sent you a copy of some legislation in Illinois that was based on what we call deflection. That what it did was, when a person comes into a police station with drugs and things of that nature, rather than locking them up, they would deflect it away from the criminal justice system and seek to get help for those individuals. You're going to hear more about that in a few weeks as we come up. But um, these could be more effective policies for the reduction of crime and recidivism. That's why I'm a strong advocate of not locking them up, throwing away the key, but to deal with the rehabilitation. I think when you rehabilitate someone, you give them a chance to be healed. How come we don't look at it as law enforcement as a health crisis? Well, we do now, because we have things like Noxalone, Narcan, that is now part of the arsenal that first responders, including law enforcement people, uh, carry to help them to be able to treat individuals and try to possibly save lives. So, as this says here, is as if we can identify the underlying reasons, such as the mental health issues and addiction, why a person uses or abuses drugs, then we can form strategies to reduce drug-related criminal behavior. Amen to that. And so law enforcement's role would change from soldiers to um, almost like psychologists or social workers, um, to divert to treatment, and will help those individuals with their first contact with programs like the deflection program that I provided a copy of for you. If it's 2380 legislation that is old, but it's in law. It's on the books now. Okay, says, jumping down, while the theory of war on drugs seemed appropriate at the time, it has shown that enforcement policies to address societal issues significantly affected people of color, and that there was a tremendous disparity in discriminatory enforcement. Often the male figure was arrested for drug use, and the whole family would just fall apart, operating with single families, which parent homes, which is not disastrous, but it's problematic. Fathers and husbands with no employment and few skills were enticed to the drug market because of the pressures, and also the desperation to obtain money for people. So that's why not only with the treatment of drugs, but also there must be services such as employment opportunities. Education is a big key. I'm a big advocate of education is cheaper than to incarcerate, and that in the long run, education will help our society as opposed to more incarceration. Okay. So there was laws passed by President Obama, um, and the Fair Sentencing Act, authored by our state, our U.S. Senator Dick Durbin, to change sentencing disparity and to help individuals to deal with the issue. Look at what it says here. It says, we talked about the need to address the crack powder sentencing disparity far too long. With the Fair Sentencing Act, now the law of the land, there will be an address to the injustices in our war on drugs. Drug use is definitely a serious problem, according to Senator Durbin. We need tough legislation. But in addition to being tough, laws must be smart and fair. And so that's what that legislation did. So there is some treatment that is taking place and laws coming out, such as the one that I mentioned earlier. There's we move more toward reform and alternatives to criminal sanctions to drug-related crimes. Again, if we eliminate or minimize drug-related crimes, our crime numbers will drop tremendously. I mean, unbelievable. And so it is important for us to stress to you guys who are future parole officers, probation officers, correction officers, law enforcement officers, attorneys, defense and prosecution, future legislators, politicians, that we must make sure that we be more about eliminating, or should I say minimizing, recidivism. Okay. So now let's look at the last section here. And we've pretty much covered this here. Punishment. The traditional goals of criminal justice systems were deterrence, rehabilitation, incapacitation, and punishment or retribution. And the punishment or incapacitation began to get weaker and not effective. And so we began to move, as we are moving now, to the direction of helping individuals. We have the drug courts. I already talked about that, where we, rather than lock people up for long periods of time, we make it a condition of not going to prison or jail to participate in drug treatment or alcohol treatment programs. And then this is the history of that. If you click on this, you can see these things also down here, starting with 89 and moving all the way through to mental health courts and helping veterans, which is long overdue, and working to address the problems and recognize that there is a challenge to treating, as it says, a drug or mental health offender. But we're recognizing that some severe side effects associated with antipsychotic drugs that are used create some ethical issues. So what we need to do is, instead of drugging people with another drug, such as I know people deal with opioid, they deal with methadone and things like that, which we'll talk about in weeks 5 and week 4 and 5. They're not really going to do it. They're like putting a band-aid on. So we have professionals in the area. Just, I mean, combine that with what we have here already with the COVID-19 issue. Um, it's like devastating to the existence of our society. So rehabilitation is the thing that we will work on the most. Okay. So it's kind of like all of those things that I've talked about. Now, the knowledge check, you can go through and you can do this yourself, but I'm just letting you know it's here. So you're going to go through these. Patients with schizophrenia tend to have high rates of alcohol and tobacco use, sleep disorder, weight loss, and caffeine use. High rates of alcohol and tobacco use. We talked about it. And then you can go through and you do the next one. During the Obama administration, which pact was signed into law? Yeah. So you could go through and you can use those to help you prepare along with the PowerPoints and information I gave you. Please complete the mid-quarter survey. So that's it for tonight. So I'm going to give you a key phrase before I let you go. And that's mental illness. Mental illness, which was the predominant issue that we discussed today that relate to drugs. So give me that and you will get your points. All right, I will see you next week, next Wednesday at 8:30 p.m. Central Standard Time. Have a good week. Again, remember the things that I covered earlier about your assignments. If you have any questions, you know what to do. You can reach out to me. Good night.